Welcome back, everybody. It's Wednesday on the Now Morning Show, and we are going to be speaking now about keeping clients safe at care homes. And Natalie has this one in this morning Spotlight on Now.
All right, welcome back to the No Morning Show here on TTT. I am Natalie Legrand. As Carrie said, we're going to be talking about, care for the elderly and just what that has looked like, how we keep them safe, even the workers in these places during the pandemic. So let's welcome to the program Carolyn Ruiz, who is president of the Residential Care Association of Trinidad and Tobago, or TNT Residential Care Association. Good morning to you, Ms. Ruiz.
Good morning, Natalie. Thank you for having me on.
Thank you so much for joining us. Yes, and thanks for getting up early. I know what your schedule is like. So talk to us. I think that, one of the things that for many of us who have our parents, our aunts, our loved ones in these residential care homes, you're always nervous about how they're going to be safe during a pandemic. And we have heard of, cases within the homes and even deaths. So talk to us about what, the association can and has put in place to try to keep everybody safe in this space.
Well, Natalie, first of all, I would like to thank the Minister of Health, Minister Terence Dayal Singh. I would like to thank Dr. Doon, Rohit Doon, and Mr. Sitaram. These are the gentlemen that we have been liaising with. And working with. In March of 2020, Natalie, we met with Ministry of Health to discuss and have an input in the infectious prevention control guidelines. So we follow the IPC guidelines, Natalie, which is wearing of masks, social distancing, and washing of hands. Natalie, that has been really a challenge for the homeowners and the staff because we are dealing with clients that are Alzheimer's, and that challenge was, and it still is a challenge, but we are now getting with it. Natalie, we had first started limited visitation in 2020. In starting limited visitation, we really asked the sponsors not to visit. Then it became no visitation.
Yeah.
So we had a lockdown on the homes. A lot of the sponsors and family, the relatives could not understand why they couldn't come to see their loved ones. So it took a little while for them to adjust to that. We still have no visitation at the hour at the homes. Then we had to come up with a solution how they could correspond with their loved ones. So what we did, Natalie, was we had them call via WhatsApp and FaceTime so that they could still have some sort of communication.
Yeah. And I know
wearing of masks.
I know that has to be particularly difficult because, I know that in some of these care homes, not all the clients are in a position to have that kind of conversation or to have that kind of interaction.
Yes, Natalie, it is a very tough time for homeowners. We are trying to cope the best we can. It is really challenging, not only for the homeowners, but for the staff. And I must say thank you to the staff because the staff has been there fighting this good fight with us. So, what we got between March of 2020 to now, we didn't have that in previous times. So for that, we want to say thank you to our staff. Natalie, the problems we had was we had
what are some of those adjustments that the staff had to make, just to try to provide care for the clients during the pandemic?
Well, Natalie, we put in place where when a staff come to work, they had to go and shower, then they had to sanitize, they had to put on their mask. We started, when mask wearing started, we were wearing masks and shields. right? Because remember, we have to interact with these clients.
Yeah.
So we were wearing masks and shields, and we sometimes, they have, on their own, they have doubled up the masks and the shields because they have to come close range to the clients, right? Yeah. Remember, we have to feed them, we have to bathe them, and they are bedridden clients also. So the challenges was mostly with the Alzheimer's because of the fact that they don't understand why they had to wear a mask or social distance. You know, they will normally walk through the house, going to places where they shouldn't, and you always have to guide them. So it was difficult where that was concerned. But I think by now we have that under control, right?
And yet we heard from the Ministry of Health's press conference that we had spread in the homes. So if we had all of these, you know, measures in place, how did we end up with the cases there? And I mean, we know we're going to have cases everywhere, and we have. But, you know, if you could just talk to us about, you know, how we ended up there, and, you know, what is it that you now have to change so that we don't keep those numbers in the homes?
Natalie, we want to believe, we cannot say for sure, but we want to believe that clinical appointments was one of the areas, because we had clients like with cancer clients or dialysis, clients going for dialysis, and they had to go, they could not miss their appointments. So we want to believe, even clients that maybe just fell ill and we sent to the hospitals, that it came through that channel, but there are one or two that the homes, when I spoke to them, they said that they believe it came with the staff, right? But there are homes that are saying it is from the hospitals at that point. Natalie, we have to say for the year and about 3 months, we had it under control, right? And all of a sudden this happened. Yeah. So we really can't say where, we are just assuming. But now that that has happened, what we did was put certain measures in place. For instance, as I just spoke to you about the mask wearing, well, we have always been sanitizing properly. A matter of fact, Natalie, we use a lot of sanitization process, so it's a lot of money. We have clients now coming in, going to their appointments, and when they come back, what we do is we isolate them normally for 5 to 7 days. In doing the isolation, we would not have all the staff attending to them. We'll put certain staff to deal with them. Now, because of the situation at homes, we have changed that to 7 to 14 days isolation to ensure. In doing that, Natalie, normally, yes, for decades, we have been doing vitals twice a day. We do it in the morning and we'll do it in the afternoon, unless the doctor otherwise give us some instructions. Now we have been doing it 4 times a day because we want to be sure that the temperature is good, that the oxygen level is good, you know, that the pressure is good, the who are diabetic, to, you know, to be certain that they are not having any signs or symptoms before we put them back into these settings.
Yeah. How do they respond to that, though? How do they respond to that? Because I know that especially when you have to deal with older people, and especially if they have any kind of mental illness, that they don't, you know, respond to isolation well. So how do you do that and keep them controlled without crossing the line of abuse? Because I know, as you said, that it's a difficult sell.
It is a difficult task. We have to speak with them. We speak to them more now than we would have spoken to them before. Yeah. So it's a lot of work at this time for us, having to speak to them. And then even the ones that are aware, Natalie, because there are those who listen to the briefings and listen to the news and they ask questions. One of the challenges we had with those is that when they are accustomed going for a day, they're accustomed going for a weekend with their relatives, or they're accustomed going to activity centers. So that too was a challenge because they started to get fatigued, right?
Yeah.
So we had to come up with things to keep them busy during the course of the day. So besides having to clean every minute, because we have to sanitize every minute, and when they use the bathroom, that is after each use. So it was a challenge. It still is a challenge. I think we are getting accustomed of what we are doing now. So
yeah.
it's also new to us, and we are coping. We are coping so far.
You know what, Ms. Ruiz? One of the things that I think I've noticed since the pandemic is that there are so many things that we're doing now that we should have been doing all our lives. Because what we've recognized is that with the frequent hand washing is that we're having less cases of influenza and, you know, just general viruses and stuff that are associated with the germs. So my question then to you is, what will the association do to ensure that these measures that are in place aren't just thrown out, you know, the window once the pandemic is under control and things are back to normal, so to speak?
Well, we have decided as homeowners that what we started now, we want to continue, right? We want to continue after the pandemic end, and we are hoping it ends soon. We want to continue what we have put in place, because we have put in place, a lot of the homes did not have isolation rooms, or they only had one room as isolation. Natalie, we had to go in, TTRCA core team went into these homes, and we worked with them. We created isolation areas, because these are things that, you know, we took for granted. That why should we need an isolation room when we send them to the hospital? Because normally we send them to the hospital once we pick up signs of anything. So the isolation room was it is a requirement in the act, but most of the homes didn't really have 2 or 3 isolation rooms. It would be just one room. So we created areas in the homes, in the home setting, that we have that facility now, and that has to continue, right? Natalie, in 2020, we decided as homeowners that we wasn't going to take the risk, because we didn't know what was coming, right? We didn't know how are we going to handle it. So we said we weren't going to take any new clients. In the latter part of 2020, we decided, according to how the ministry rolled out stuff, we decided we will open back up and take clients. We spoke to the sponsors. We let them know that they will have to be isolated for 14 to 21 days. And we did that. That now has changed, where we are not going to accept clients without a same-day PCR test. So we need to get that before admission. And we're going to still quarantine them for 10 days.
Ms. Ruiz, talk to us about, you know, during the pandemic, I mean, apart from the fact that we saw businesses had to close, never to be reopened again because, you know, they couldn't sustain themselves. Did we have issues with the care home with getting payments for clients?
Yes, we did.
And did we have any care homes that closed as a result?
Yes, several has closed down as a result, Natalie. This is a challenge we had long before the pandemic. This is not something that is new to us. It just got worse because there were people that lost their jobs or were getting less income coming in. But right now there are a lot of client sponsors that are outstanding. And Natalie, in 2020, mid-2020, we started to realize that it was a fight to survive. Right? And we reached out to people to assist us. Nobody never assisted us. We never even got as much as a phone call. So what we did was we tried to get help from families and friends, but Natalie, so much you can ask because they too is in a crisis, right? So we started sharing with homes who didn't have this, and if you had more than, we started sharing, and that is what sustains most of us.
Well, I'm happy to hear that you all were able to come together and help each other. But what do you do? What do you do as an association to prevent abuse of the elderly? Because we do hear of these situations in homes too. So you might have this home that care for the elderly and treat them well, and then you have a home and you're hearing of all the abuse coming out of it, and, you know, people, the beating people, all kind of these things. So what do you do as an association, you know, to ensure that these things don't happen or are minimized?
Natalie, I am not saying that there isn't abuse in the homes. Natalie, sometimes people believe that there is abuse, and it's the client bawling out because of their illness, right? But I'm not saying that there isn't. And I'm also want to highlight that most of the abuse, if you check, is not coming out from homes for the elderly. It's coming out from your own private homes, right? But we are always on that topic. Even in our meetings, we are on that topic. We said, if you have issues to the members, reach out to us. We are here. We are not here to discriminate. We use the friendly arm to deal with the situations. If it is a situation that we cannot deal with, then we will get the authorities in. But to say that, you know, when people highlight and abuse, they highlight it as though it's all homes, and that's not the truth.
We are out of time, but I just wanted to know what percentage of the people, the clients in the care homes, are vaccinated at this time. Are we having hesitancy there?
It is around, well, we had. And then Mr. Dial Singh came out and he spoke, and then we got an increase. So it's about 71% vaccinated.
Okay. We do have to leave it there, Ms. Ruiz, but I want to thank you so much for sharing with us this morning.
Most welcome.
And all the best. And I really hope you all continue to get help and to help each other so that we can continue to keep the clients safe.
Thank you, Natalie, for having me.
All right, you're most welcome, guys. So unfortunately, I'm going to toss to a quick break, so we'll be right back. Stay with us. Lots more coming up in the program.